Results last night. One of our congresswomen proposed a new effort to expand healthcare services for indigenous communities.
Indian Health Service will be partnering with the University of New Mexico to help provide some of those services. Our Jacqueline Aragon has a look at what those new services might look like.
As our tribal nations entered into agreements with the U.S. government, the provision of healthcare was actually part and parcel of those agreements.
Despite that decade-old promise, New Mexico's tribal communities continue to struggle to get access to adequate and efficient health care.
There are many reasons for this. It includes geographic barriers, historical trauma, funding shortages, a lack of providers, and a lack of basic infrastructure for health care in our tribal communities. And as a result of this, it results in higher rates of all different kinds of chronic diseases, financial burdens, and of course, a reduced quality of life.
Albuquerque Congresswoman Melanie Stansbury wants to leverage UNM medical students.
The Indian Health Service Provider Expansion Act builds off of an existing residency program that is operated by the University of New Mexico's Family Medicine Residency that's based out of Shiprock. And it's one of the premier and best programs in the country, and in fact is the program currently that serves our Indian Health Service.
The partnership gives people access to health care, and UNM med students get hands-on experience.
We have patients that hitchhike to us. We have patients that have to get, coordinate all their family care just to be able to come to an appointment. So we try our best to kind of do a full visit every time someone comes to see us.
The program could also help expand outreach that brings clinical into communities that are desperate to see the government deliver on its promise of health care. Jacqueline Aragon, KOB4.